Welcome to the deep dive. You've brought us a topic that, well, a lot of pet owners grapple with. Why dogs and cats sometimes get those frustrating tummy troubles after eating.
Yeah, it's super common.
We've got your sources right here, and today we're going to really unpack the differences between food allergies and food intolerances, especially focusing on those GI signs.
It's not always clear cut, is it?
Not at all.
Yeah.
So our mission is basically to give you a clear picture of the why behind these reactions.
Exactly. Because, while people often say allergy for any bad reaction, there's actually a technical difference.
Right.
We'll look at true food allergy, that's the immune system reacting, versus food intolerance, which is non-immunologic. The signs can look similar, confusingly.
Okay.
And we'll touch briefly on toxic reactions too, though thankfully they're a bit less common.
Good. Okay, let's dive in then, starting with the nitty-gritty, the pathophysiology. For a real food allergy, what's the main thing happening?
Well, with a true allergy, the immune system essentially messes up. It sees a normal food protein as like an invader
So it overreacts.
massively. And often, this involves problems with the gut lining itself. You might hear the term leaky gut. Basically, the barrier gets compromised.
Ah,
This lets things through that shouldn't be there, leading to, well, a dysregulated immune response. The body kind of forgets how to tolerate that food.
and it reacts strongly.
Yeah, often it's what's called a type 1 hypersensitivity. That means it's usually quite a rapid and intense immune response.
So the body's defenses are fighting something harmless. What kind of foods usually trigger this? What are the common culprits?
It's often the proteins we see in lots of pet foods. Things like milk, eggs, beef, chicken, those are big
So
ones.
really common ingredients.
Exactly. And also plant proteins, think corn, wheat, soybeans. They can definitely be triggers too.
Right. So that's allergy. Now, food intolerance. That sounds different. How does that work? Is the immune system involved there?
Nope, that's the key difference.
Yeah.
Food intolerance is non-immunologic.
Yeah.
It's really a wider category covering different kinds of reactions. One big area is like individual sensitivities.
Yeah.
Maybe idiosyncratic reaction, just that one pet reacting weirdly to an additive.
Additives like.
Oh, things like artificial colorings, preservatives,
Mm.
BHA, maybe
Yeah.
MSG, sodium nitrate, sulfur dioxide, even some spices or propylene glycol.
Wow. Okay, so it's not the immune system. It's more like the body just can't handle that specific thing.
Exactly. Or it could be a pharmacologic reaction. Some foods naturally contain substances that cause effects.
Like what?
Well, histamine is a classic example. It can cause issues like flushing or GI upset. Or think about the theobromine in chocolate or caffeine. Those are psychoactive or stimulants.
Oh, right. Chocolate toxicity is a thing.
Well, that's more toxicity, but the compounds themselves can cause pharmacologic effects, even in smaller amounts for some. Then you have metabolic issues.
Metabolic, like digestion.
Yeah, like lacking an enzyme. Lactase deficiency is the famous one in humans, right? Can't digest milk sugar. Pets can have similar enzyme issues. And there's even a link between a deficiency in an enzyme called aminopeptidase N and gluten sensitivity in some breeds.
Gluten sensitivity. We'll come back to that, I bet.
Yeah.
So intolerance covers additives, natural chemicals, enzyme problems. But what else? And then there are the toxic reactions we mentioned earlier. This is different again. It's when the food itself contains something harmful or it's spoiled.
Like eating onions.
Exactly. Onion poisoning is a toxic reaction. Or eating spoiled food with bacterial toxins like botulism, though that's rare. Or fungal toxins like aflatoxin in contaminated grains.
Right.
Even things like certain spices, oxalates in some plants, lectins. And just plain old dietary indiscretion raiding the bin.
Yes. My dog knows all about that. Okay, so allergy, immune, intolerance, non-immune sensitivities, processing issues, and toxic reactions. Got it.
Right.
Which body systems take the hit most often?
Primarily, we see issues with the skin, the dermatologic system, itching, hair loss, that kind of thing.
Right.
And very commonly, the gastrointestinal system, of course, tummy upset. And sometimes the endocrine or metabolic systems can be involved too. And you mentioned breeds earlier. Is there a strong genetic link for some pets?
Oh, definitely. Genetics can play a big role. We know, for example, that soft-coated Wheaten Terriers can have a heritable form of food allergy. It seems to run in families. And German Shepherds. They have a known predisposition to immune-mediated intestinal inflammation, kind of like IBD. And in these dogs, diet can be a major trigger because of, well, underlying issues with their innate immunity.
So their genes make them more vulnerable to dietary triggers.
That seems to be the case. And then there's gluten-sensitive enteropathy, which we see primarily in Irish setters.
Ah, yes, the gluten link again.
Right, and that's linked to that aminopeptidase and enzyme deficiency we mentioned. And there's some suggestion, maybe less well-defined, that Siamese cats and Siamese crosses might have a higher risk too.
Okay, so breed is definitely something to keep in mind. How common are these reactions overall? And does age or sex matter?
It's interesting. Some studies suggest adverse food reactions might actually be slightly more common in cats than dogs. Yeah. But honestly, any pet, any age, any breed, male or female, can be affected. But we do see patterns.
Like the breeds you mentioned.
Exactly. And those Irish setters with gluten issues, they often show signs pretty young, maybe 4 to 7 months old. And for dogs with chronic gut problems that respond well to diet changes, they often tend to be younger adults.
Okay, so age can be a clue sometimes. How do the signs differ typically between, say, intolerance and allergy? What should you be watching for?
With food intolerance, you're typically looking at GI signs. Diarrhea could be small bowel, could be large bowel type vomiting, maybe lots of gas, not wanting to eat, belly discomfort,
Standard tummy upset signs?
pretty much. Now, food allergy, that often shows up more on the skin.
Hmm.
Intense itching, hair loss are really common.
Ah, the itchy pet.
Right. Now, pets with food allergies can sometimes have GI signs too, but it's actually not that common for them to have like severe problems in both systems at the exact same time.
That's a really helpful distinction. So, relentless itching might point more towards allergy. What about the pet's history or what a vet might find during an exam? Any clues there?
Well, a key piece of history is often the timing. Owners might say, yeah, the diarrhea started right after we switched his food, or we tried this new treat.
The dietary change link.
Exactly. Or sometimes they notice the pet feels better if they skip a meal, or if they feed something really bland for a day or two. That improvement with fasting or a simple diet is a big clue.
Makes sense. Remove the trigger. Signs improve. What about the physical exam itself?
Often the findings are pretty non-specific, unfortunately. Maybe some tenderness when pressing on the belly. You might hear more gas moving around. Maybe the abdomen feels a bit bloated.
Okay.
If there are skin signs from an allergy, especially in cats, you might see that patchy hair loss, often around the ears and eyes.
Right. So it sounds like diagnosing this isn't always straightforward because the signs overlap with other things.
Totally. It's often a process of elimination. Pardon the pun.
Huh. So let's recap those causes and risk factors again, just to make sure we've got them clear. It's a wide range.
It really is. For intolerance, you've got all those potential reactions to additives, natural food chemicals, the metabolic stuff like enzyme deficiencies, and then the toxic reactions from specific foods like onions or spoiled food.
So many possibilities.
Absolutely. And for allergies, it's usually those common proteins, beef, chicken, dairy, soy, wheat, corn, and risk factors. Well, being a young Irish setter puts you at risk for gluten issues, especially if you get gluten early.
Right.
And that genetic susceptibility in breeds like Wheaten Terriers and German Shepherds is definitely a key risk factor too.
Okay. So history, breed, signs, they all give clues. How do vets actually diagnose this then? You said it's like ruling things out.
It really is. First, you have to consider other things that cause similar signs. Inflammatory bowel disease, gut parasites, maybe the pancreas isn't working right. That's exocrine pancreatic insufficiency or EPI, or even some types of diarrhea that just respond to antibiotics.
So you check for those first.
Yeah, you often run tests to rule those out. Then, if you still suspect a food reaction, the main diagnostic step really is seeing if the GI signs get better on an elimination diet.
The special diet trial.
Exactly. These diets use either hydrolyzed proteins, meaning they're broken down so small the immune system hopefully doesn't recognize them, or a novel protein,
Novel meaning.
something the pet has definitely never eaten before, like kangaroo or venison or duck, maybe, if they've only ever had chicken and beef.
Yeah, sure. What about homemade diets for these trials? Are they okay?
They can be used for the short trial period because you have total control over ingredients, but they're really hard to balance nutritionally for the long term.
So not ideal forever.
Generally not, no. Commercial prescription diets are usually the way to go for long-term management because they're complete and balanced.
Okay. And how fast should you see improvement on this special diet if food is the issue?
Often pretty quickly, especially with GI signs. Sometimes within a few days you might see a difference. Cats in particular can respond quite fast.
That's good news for worried owners. What about blood tests? Can they diagnose a food allergy or intolerance?
Standard blood work like a CBC and chemistry panel is usually normal. It doesn't really point towards a food reaction itself.
Hmm.
Sometimes, with allergies, you might see an increase in eosinophils, a type of white blood cell, but it's not consistent and not specific. So blood tests are mainly useful for ruling out other diseases.
Okay, so they help check for other problems. Any other lab tests?
Well, you might run tests like folate and cobalamin levels to check small intestine health, or a TLI test to rule out that pancreatic insufficiency EPI.
Right.
But those blood tests that you can buy, the ones claiming to test for specific food allergies by measuring antibodies, generally they're considered unreliable in pets. The evidence just isn't strong for them.
Good to know because you see those advertised. What about x-rays or ultrasound?
Yeah, imaging can be really important. It helps rule out things like intestinal blockages, tumors, or other structural problems that could cause vomiting or diarrhea.
So looking for physical causes.
Exactly. There's also a specialized technique, Doppler ultrasound, that looks at blood flow, which has been studied in some GI cases in dogs, but it's not routine for food reactions.
Okay, so it sounds like that elimination diet trial really is the key diagnostic tool. What's the usual protocol? How long does it last?
Typically for GI signs, we recommend about 2 weeks for cats and maybe 3 weeks for dogs.
And during that time?
Strictness is everything. Only the prescribed diet, no treats, no table scraps, no flavored medications if you can possibly avoid them. Nothing else should pass their lips.
Wow, that takes commitment from the owner.
It absolutely does. Because even a tiny bit of the offending food can mess up the trial.
Okay, so if the pet gets much better on the strict diet, what's next? Do you have to prove which food it was?
Well, the gold standard technically is to do a challenge.
Yeah.
You reintroduce single ingredients, one by one, back into the diet and watch closely to see if the signs come back.
Ah, to pinpoint the trigger.
Exactly. But honestly, in practice, that's really difficult for most owners to manage perfectly at home. It takes a long time, and it's easy to make mistakes.
I can imagine. So what usually happens?
Often, if the pet does really well on a specific novel protein or hydrolyzed diet during the trial, the long-term plan is just to stick with that diet exclusively. Find one that works and stay on it.
Keep it simple and safe.
Pretty much. It prevents relapses.
You mentioned something specific for Wheaten Terriers earlier,
Yeah.
about screening.
Ah, yes. Because those soft-coated Wheaten Terriers with food allergies can also be prone to kidney issues, specifically protein-losing nephropathy. So it's recommended to screen them regularly
Ow.
with a urinalysis and a urine protein.creatinine ratio test, just to check for protein leaking into the urine, which would be a sign of kidney damage.
Good to know for that breed. Now, if you did take biopsies, like during an endoscopy, what might you see in a food allergy case?
You might see some changes in the intestinal lining, maybe some shortening or flattening of those little finger-like projections. We call that villus atrophy.
Okay.
And you might see a mild increase in certain inflammatory cells, usually lymphocytes and plasma cells. So a mild lymphoplasmacytic enteritis. A biopsy can confirm inflammation is present.
So it can give more concrete evidence sometimes. All right, let's talk treatment and prevention. We've diagnosed it or we strongly suspect it. What's the plan?
Mostly it's outpatient management, focusing heavily on diet. Like we've been saying, a hydrolyzed protein diet or a novel intact protein diet is usually the way forward.
And stick to it.
Absolutely. And remember, cats especially can sometimes be tricky, sure. They might be sensitive to more than one ingredient.
So finding the right novel protein might take a bit of trial and error even then.
It potentially could, yeah. But the good news is there are lots of excellent commercial therapeutic diets available now.
Research diets.
Right. And it's always worth scrutinizing the ingredient list, even on those, just to be aware of what's in there.
And the message about extras.
Crucial. No treats, no scraps, nothing besides the special diet. Seriously, even tiny amounts can derail everything.
Got it. Strict means strict. Do these pets usually need medications for the food reaction itself?
Generally, no. If the diet works, the diet is the treatment. Medications might be needed if there's something else going on at the same time, like maybe secondary bacterial overgrowth needing antibiotics, or if they also have IBD needing its own treatment.
Okay, so diet first, treat other issues if they pop up. How do you monitor if the diet's actually doing its job?
You watch the pet. Are the clinical signs, the diarrhea, the vomiting, the itching, clearly getting better and staying better? That's your main indicator.
Makes sense.
And if a pet doesn't respond well to a really strict diet trial, then you have to start thinking, okay, maybe this isn't just a simple food reaction. Maybe there's a primary gut disease, like more severe IBD, that needs further investigation, maybe biopsies.
So if the diet doesn't work, dig deeper. What about prevention? Can we stop these reactions from happening?
The best prevention is avoidance. Once you know what ingredient triggers a reaction in your pet, you avoid it completely.
Simple as that.
Well, simple in concept. If you haven't pinpointed the exact allergen through challenges, then the prevention strategy is just sticking religiously to the exclusion diet that, works for them.
Find a safe food and stick to it. Okay, so what's the overall outlook, the prognosis for these pets?
Generally, it's excellent. For most dogs and cats, if the owner can be really strict with the recommended diet long term, the prognosis for a full recovery and good quality of life is very, very good.
That's great to hear.
The only slight caveat is maybe for those soft-coated Wheaten Terriers with the heritable food allergy, their prognosis for a complete cure might be a bit more guarded, perhaps because of that underlying genetic component and potential for kidney issues.
Okay, a little more caution there. Are there any common complications to watch out for?
Sometimes pets with ongoing food sensitivities or allergies might be more prone to developing other issues, like antibiotic-responsive diarrhea, or even progressing to full-blown inflammatory bowel disease over time. So ongoing monitoring is still important.
Right, it's not always isolated. Well, this has been incredibly informative. We've covered a lot. Let's try and summarize the key points for you, our listener.
Yeah, I think the big takeaway is that these adverse food reactions,
Hmm.
they're complex, right? They can show up in lots of ways, especially GI signs.
Definitely.
And telling apart allergies, intolerances, and toxicities matters for how we manage them. Diagnosis often really hinges on that careful elimination diet trial.
And sticking to it.
Absolutely strict dietary management is usually the key to getting things under control and keeping them that way for most pets.
And it really highlights why working closely with your vet is so important, doesn't it? To navigate all this and find the right food solution.
It really does. Which, leaves us with a final thought for you to consider. We've talked about this huge range of potential food triggers, allergies, intolerances, and so many different things. What does that mean for the pet food industry and for the research that's still going on? What are the implications there?
Definitely something to mull over. Thanks for that deep dive.
My pleasure.